You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hello, this is Dr. Marzell, and welcome to my podcast today. Today's subject will be how to prevent breast cancer. And a lot of people are talking about how to detect breast cancer early. And this is very, very important. We have several types of imaging options, frequency of imaging, and so on. But there's not a lot of talk going around about why women are getting breast cancer and how to prevent it. Now, for those of you women who say, well, I know what causes breast cancer, estrogen does, you are wrong. Breast cancer can be stimulated to grow by estrogen if you have the type of cancer that is estrogen receptor positive, in other words, has receptors to hear estrogen. That is the type of cancer that can be stimulated to grow from estrogen. However, just taking estrogen doesn't necessarily mean that will occur. You have to have that proclivity, and that's where genetic testing is also making a big effort to screen women so that we know which ones are susceptible. So I would like to talk a little bit about one of my favorite minerals, and that is iodine and the effect that that has on breast health. But it may surprise you to learn that a simple mineral, iodine, can not only protect against breast cancer, but can help fight the disease. Research has been done on animals using a substance that blocks iodine attaching to breast cells. It's called perchlorate, for those of you who like to know every little detail. After blocking iodine from breast tissue from 8 weeks, tissue was examined in a particular study and found to have developed a precancerous pattern. When the iodine was blocked and the estrogen was added, there was less precancerous looking cells. And when iodine was blocked and thyroid hormone added, there were the same precancerous tissue changes present. This shows that it's the iodine itself that can protect breast tissue from developing into cancer, not thyroid hormone. There used to be a confusion about that. Iodine has been shown to actually kill certain strains of cancer cells that cause breast cancer. Iodine has been shown to soften breast tissue and reverse fibrocystic changes. These characteristics are a risk factor for breast cancer. And this is, quite frankly, why it's important to get an exam. I know that a lot of my patients have gotten used to telehealth, and there's nothing wrong with telehealth. I like it very much myself. But it helps so much to come in and get an examination where you can see if a patient is susceptible to breast cancer or has characteristics putting them at an increased risk just because you can feel it in the tissue. Now, you may have noticed that Japanese women have one of the lowest rates of breast cancer. And all you have to do to figure out why is think of what type of a diet they eat in Japan. Well, they eat a lot of fish. fish comes from the ocean, and the ocean is a good source of iodine, and fish is high in iodine. They also eat a lot of kelp and seaweed. As a matter of fact, I went into a grocery store one time. It was a huge Japanese grocery store. I couldn't believe the different barrels of dried seaweed with a whole different flavor. There was the tamari seaweed, and there was the barbecued seaweed, and the salted seaweed, and the unsalted. I couldn't believe the variety. So the Japanese diet is very strong in iodine, and the women have one of the lowest rates of breast cancer. We think it's probably due to iodine. Over here in the States, we don't eat a lot of fish. Most people are lucky if they have it once a week. And we certainly don't eat a lot of seaweed, although we could, but we don't usually. There's a specific type of iodine that works best on breast tissue. So it's really important if you want to make sure that you're doing some things to prevent cancer, and why not do them rather than just screening? Why not take things that may prevent the development by itself? So there's two different types of iodine. One is molecular iodine, and one is iodide, which is potassium iodide. It's in salt. It's a type of salt. The type of iodine preferred for the thyroid is the iodine salt, iodide. Iodine is preferred for breast tissue. And the strongest solution, which, by the way, is a prescription solution, is called a Lugol's solution. Now, I stock this at our private pharmacy, which can only be obtained with prescription. So it can only be obtained through for my patients. I know a lot of people get this off the internet, and often they get a very low dose off the internet because it is non-prescription. So it is helpful to hook up with someone that knows something about this and can prescribe it. Iodine will actually do a remarkable job shrinking breast cysts. Many women have fibrocystic breast disease, and they're having pain in their breasts and discomfort. This can be rectified by providing iodine. Iodine will shrink up the cysts, will soften hard, fibrous breast tissue, and it combines with the fatty tissue within the breast to change into breast cancer killing substances. So they may actually, if a cancer is starting, may be able to kill it within the breast itself. It's pretty remarkable. There's a technique that I was taught when I learned about iodine and its effect on the breast, which is really remarkable. And getting it into the body quickly is really important. So this is where we do, and we call it an iodine painting. We take an iodine solution and paint it vaginally. The vagina is very kind of sponge-like. It just sucks up whatever you put in there. And iodine is so important with breast tissue that within half an hour or so, an hour, it's in the breast tissue, softening up and reversing that firm tissue. So it's so important for patients to come in. I can check their breast tissue. I know if they have the type that predisposes them to developing a cancer. If that is true, they should, number one, take an oral iodine. You only need to take a drop a day in a little juice or something. And you can also put it topically on the breast tissue. And sometimes, in addition to that, we do the vaginal application to get it going right away. So I think I'm going to conclude with this, although there's other things I'd like to say about breast health, and I'll put those in Chapter 2. But think with fondness of seaweed, fish in your diet, and maybe consider having a little more iodine in there somewhere. Hopefully you found this fascinating as I have, and look forward to seeing you at the next podcast. Have a great day.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.